As Ontario waits for more vaccines while battling this third wave, epidemiologists say COVID-19 testing is more important than ever before. But testing numbers in the province have dipped in recent weeks, and a number of residents tell us they've been turned away from testing centres despite being exposed to the virus. Ontario's COVID-19 testing guidelines haven't been updated for 7 months. It was back in September 2020 when the province changed its testing approach from anyone who wants a test can get a test to specific criteria. People who are symptomatic, have had close contact with someone who has tested positive, are part of an outbreak investigation, or are part of a targeted high-risk group. Their reason at the time, with the flu and cold season approaching, they wanted to ensure testing resources were available for those who needed them the most. But since then, cases in the province have skyrocketed, Ontario now battling a brutal third wave with a slower than anticipated vaccine rollout. And epidemiologists tell us testing is crucial, especially for essential workers.
If we test them, we can find infected people, infected families. We can isolate them, we can treat them, we can break transmission.
But CityNews has heard from a number of residents in recent weeks, including essential workers, turned away from testing centres despite exposure.
I was sitting in front of her. She had the test in her hand with my name on the bag, and I was stunned, to be honest.
Barry Sternberg owns an electrical contracting business, and one of his staff tested positive last week. Despite sharing an office space with the employee, he was denied a test because he hadn't come in direct contact with them, and he wasn't showing any symptoms.
My mother's elderly, and I certainly wouldn't want to pass it on to her or anybody else for that matter, and a special needs daughter who's compromised, considering the numbers, how high they are. Anybody who wants to get tested should be able to get tested.
But in fact, there were more tests being completed during the peak of the second wave than the third, with an average 56,000 between January and February compared to 52,000 in the last month. The province tells us a number of factors could be contributing to testing volumes, including a Ministry of Health directive issued in February shifting long-term care homes to rapid antigen testing, fewer long-term care home outbreaks requiring laboratory testing, and a shift in public demand. We asked the Ministry of Health if there are any plans to update the criteria. They tell us they'll have an update for us later this week. For City News, I'm Yazdani.